Kidney stones. Just the name sends shivers down your spine. Many people say it's one of the most painful experiences imaginable, like a sharp stabbing pain in your back, side, or even lower abdomen. Sadly, kidney stones are surprisingly common. Millions of people suffer from them every year. But there's good news. We can understand kidney stones and fight back. We can learn what causes them, how to recognize the signs, and most importantly, how to prevent them. Knowledge is power. Let's take charge of our kidney health together. So, what exactly are kidney stones? Imagine tiny crystals like grains of sand, forming inside your kidneys. These crystals are made from substances in your urine. Usually your urine has enough liquid to keep these substances dissolved, but sometimes they clump together, forming those pesky stones. These stones can range in size from a tiny speck of sand to a golf ball. Ouch! As you can imagine, the bigger the stone, the bigger the problem. But don't worry, we'll talk about how to get rid of them. First, let's uncover what causes these stones in the first place. Now let's meet the usual suspects behind kidney stones. One of the biggest culprits is dehydration. Not drinking enough water is a recipe for disaster. When you're dehydrated, your urine becomes more concentrated, making it easier for those crystals to form. Another culprit is your diet. Eating too much salt, animal protein, and sugary drinks can increase your risk. And let's not forget about genetics. Sometimes kidney stones run in families. If your parents or siblings have had them, you might be more prone to developing them too. Kidney stones can be silent troublemakers, lurking in your kidneys without causing any symptoms. But when they start to move, oh boy, you'll know it. The pain can be sudden and intense, often striking in your back or side, radiating to your lower abdomen and groin. You might also experience painful urination, nausea, vomiting, and blood in your urine. If you experience any of these symptoms, don't wait. Seek medical attention immediately. Early diagnosis and treatment are key to preventing complications. Section 5. Unmasking the stones. How doctors diagnose the problem. So, how do doctors figure out if you have kidney stones? They'll start by asking about your symptoms and medical history. Then they'll likely recommend some tests, like a urine test to check for blood or crystals, blood tests to assess kidney function, and imaging tests like CT scans or ultrasounds to visualize the stones. These tests help doctors determine the size, location, and type of stones, which guides treatment decisions. Don't worry, these tests are generally quick and painless. Section 6. Outsmarting the stones, treatment options for every size. The good news is most kidney stones pass on their own with time and plenty of fluids. Your doctor might prescribe pain relievers to ease the discomfort and encourage you to drink lots of water to flush out the stones. But for larger stones that won't budge, there are other options like shockwave lithotripsy, which uses sound waves to break the stones into smaller pieces, or ureteroscopy, where a thin tube is inserted to remove or break up the stones. In rare cases, surgery might be necessary. Your doctor will recommend the best course of treatment based on your individual situation. Section 7. Preventing kidney stones, your guide to a stone-free life. Prevention is always better than cure, right? And when it comes to kidney stones, there's a lot you can do to stay stone-free. The golden rule is to stay hydrated. Drink plenty of water throughout the day, aiming for clear or pale yellow urine. Watch your diet. Limit salt, animal protein, and sugary drinks, and load up on fruits, vegetables, and calcium-rich foods in moderation. If you have a family history of kidney stones or other risk factors, talk to your doctor about preventive measures. Section 8. Take charge of your kidney health. Kidney stones can be a painful nuisance, but with the right knowledge and proactive steps, you can outsmart them. Remember, staying hydrated is crucial, so make water your best friend. Eat a balanced diet, be mindful of your risk factors, and don't hesitate to seek medical attention if you experience any symptoms. Your kidneys work hard for you, so show them some love by taking care of your health.